Hello, everyone who's joining us at the moment. Thank you. We're just going to give everyone else who's joining us a few more minutes and then we'll get started. Thank you. Okay, hello everyone. Welcome. We're still waiting on a few more people to join us, but time waits for no man, as they say, so we might as well get cracking. Yes, thank you everyone for joining us today for this, the first event in our new Generation Innovation series. For those of you who don't know me, my name is Nick State. I'm the founder and director of Bobab. And for those of you who don't know what Bobab is, we are the first and only event streaming and peer-to-peer networking platform dedicated exclusively to African science, tech, and innovation. Our mission, broadly speaking, is to accelerate science and tech on the continent, enhancing collaboration and spotlighting the latest commercial, scientific, and charitable innovation happening in and for Africa. How do we do that? By working with partners to design and deliver online events and workshops that, first of all, explore challenges, identify opportunities, promote solutions, and crucially, that bring diverse groups of experts together. As I mentioned, this is the first event in our new Generation Innovation series. We believe that it is Africa's young people who are going to lead the continent's science and tech revolution. And this series is dedicated to promoting them and their work, exclusively featuring contributions from innovators who are 35 years old or younger. Throughout the series, which will be an ongoing series, we'll be looking at a whole range of issues and areas, including renewable energy, agribusiness, more public health stuff, satellites for sustainability, all sorts of stuff. But today we're focusing on public health and more specifically medtech in Africa, a fascinating, complex and rapidly changing area. And we have a fantastic panel of experts lined up for you. They include Dr. Jean Chula, who's the Business Development Director at Medixus, Menyo Innocent, who's the founder and director of MScan, Shafiq Sakito, who is the VP for Business Development at Matababu and Think IT, and Dr. Suan Odiasa, who's the CTO at Telehealth. And we also have Brian Mwenda, who is the CEO of Hope Tech Plus, a fantastic lineup. These guys are ambitious, they're agenda setting, and they're going to be sharing their insights and experience of trying to navigate the challenges and opportunities presented by COVID, as well as the broader public health landscape in Africa. And also they're going to be trying to help us imagine a future post-pandemic by drawing out some of the trends that we'll be seeing develop in the next sort of 5, 10, 15 years in this space. So without further ado, let me introduce our first speaker. Dr. Jean Chula. Jean is as I mentioned, the Business Development Director at Medixus. She has an MBBS from the University of Glasgow in the UK, as well as a Master's in Public Health. She's worked in both the NHS in the UK and in the Kenyan healthcare system as a practicing clinician, as well as implementing organisational effective programs within public and private health facilities. Jean, welcome, thank you very much, and over to you.
Thank you so much, Nick. It's an absolute pleasure to be here. Allow me to share my screen. Hello, everyone who has joined us. I'm really excited. Just keeping an eye on my time, I'll get right into it. As Nick said, my name is Jean Chula. I'm the Business Development Director at Medixus, and I'll be taking you through our innovation. So just a bit of background in terms of where we are. I picked the top three countries represented by the panelists today. So while it looks like Uganda is actually leading, Kenya is the one with the highest number of cases. So as of yesterday, we had over 89,000 cases, whereas Uganda had about 23,000 and Nigeria about 70,000. And in terms of number of deaths, we've seen a sudden rise in the past few months. So we're just over 1,500 deaths here in Kenya. Nigeria just slightly over 1,100, and Uganda about 200. And this is taken from the Ministry of Health here in Kenya. So when talking about COVID-19, the opportunities presented and the existing healthcare system, what do we consider? Well, we know that Africa faces a shortage of trained healthcare workers, and certain populations are not able to access quality healthcare. And this is not just unique to the continent, this is a global problem as well. And when we employ digital health technologies, then we can help address some of these challenges. So in terms of COVID, we know that there have been challenges, yes, but there have also been amazing opportunities that have been presented. And I've just done a quick table here so that we can have a look at some of these. So no lack of finance is huge, in terms of money for infrastructure, money for hiring healthcare workers, money for a COVID response. But I think what we've really learned from this is that we need to become self-reliant. We need to stop relying on the West. We need to stop relying on donors and waiting for handouts. We really need to start being our own solution. And I'm really glad that these innovations are focusing on innovators here on the continent, because this is where the future lies. And I think, as we've seen in terms of the West and high-income countries that are grabbing vaccines, 14% of high-income countries have already taken over 53% of available vaccines. So in Africa, we really need to start relying on each other and collaborating so that we're not left behind. And where there was a lack of data, when you had really manual processes, where you just had paper initially, we've seen people become more accepting of the idea of digitization of data. Here in Kenya, we have a home-based care program, and the patients are actually monitored using a mobile app that was developed here. We're seeing people becoming accepting of teleconsultations. Healthcare workers are using tech to communicate, as I'll show you. So we're really seeing people accepting, and this is beginning to give us data insights, which is amazing. And where there was regulation issues, we usually say that regulation trails behind innovation. We're actually starting to see faster approvals. So where it would have taken years, these approvals are getting done in a matter of days. So that's a really big plus. And also policies and bills being pushed, especially here in Kenya. Now for silos, we know that this is not just unique to healthcare, different verticals, there's lots of fragmentation. But in COVID, we really had to realize that we have to work together to move ahead and to get through this pandemic. So again, a real collaborative approach there. And where people were fearful because this technology is new, they're not entirely sure what is it all about. There's been a lot of education, there's been a lot of adoption, a lot of use. So COVID has really opened up doors, and people are beginning to actually use e-health, digital health, which has been also really good. And for places where there's poor connectivity and the infrastructure was not great, people are starting to think outside the box. What can we do? You partner with telcos who can increase the connectivity. You use solar power, where you have power outages, you don't have a generator. So we're starting to get these solutions as well. Now, I know this slide doesn't project very well. It's not for you to read the fine print here. The point of this was just to show you, in terms of COVID action, who put out this call for innovators who are building resilient health systems in the midst of COVID. Over 550 applicants applied. And I wanted to point out that out of the top 30 that were chosen, 21 of these innovations were from Africa, which is just mind-blowing. There's so much innovation coming out of the continent. There's so many solutions to be found here. And if you use your eye of faith, you'll see Medixus right there. So it was a real honor to be part of these innovations. So again, another slide that shows you just that. Brighter Bridges do these innovation maps. And I just wanted to point out, in 2018, they had sort of mapped out the innovations across Africa. So for the whole year, they mapped about 100 health tech ventures, whereas in just the first quarter alone of this year, there were over 200 ventures that they were able to put together. And again, if you use your eyes of faith, there's Medixus little dot up there, and over here, we're right there as well. So coming straight through to Medixus, what are we doing in the midst of COVID? Like we've mentioned before, we know that there's a deficit of healthcare workers across Africa. And if you're working, there's shortage of staff, you're going to get burnt out. And if you're burnt out, you can't communicate well with your teams. And especially during COVID, what we saw was there was so much information. There's like an information overload, pandemic information. So where did healthcare workers go to get information? Where could they rely on information? We even saw well-respected journals having to retract publications just because information was changing so fast. So that's where we came in. Our solution is a secure mobile app that centralizes the knowledge of all healthcare workers on the continent. We aim to drive intra and inter-facility communication and collaboration. So communication within the same facility and across different facilities. And we really do that in one of three ways. Through a case collaboration tool, where healthcare workers can communicate effectively with each other and post cases in real time, regardless of where they are. A patient handover tool that uses a globalized recognized format to reduce the number of adverse events, and a continuous professional delivery tool for patients. For healthcare workers, where you can upskill your knowledge base. And really, this all feeds into each other so that you make sure that the right people access the right knowledge at the right time. So what does our product look like? As you'll see here, you're able to upload images. If you want to highlight something, if you want to redact something within the app, you're also able to do that. Handovers have follows a dashboard sort of format. It's really intuitive to use. For your cases, you can use the case feed, and it's tagged according to specialty as well. So again, healthcare workers can come on there, when they're sharing about COVID, when they want to ask something they're not sure about, it's really, really easy to use. So we've seen a lot of growth in this period. Pre-COVID, we're looking at numbers of about 668. This number actually now has risen to 1,307 as of today. Number of daily active users was about 820. We're seeing that far above, almost approaching 6,000. People are coming back onto the platform to communicate, to collaborate. Numbers of handovers before this were only at 32, but we've seen 641 patients safely handed over using the platform. And again, we had majority of doctors. That's because when the platform was first opened up, it was purely for doctors. But now in the wake of COVID, we've actually been able to sort of ring fence the platform and open it up to different cadres. So we have nurses and clinical officers, medical students, paramedics coming on as well. So a real collaborative effort. So majority of users are still doctors at 77%, but we're seeing a lot more coming on. And we've also been able to add in functionality during this time. So for our handovers, we've made it a lot easier for our users to use based on feedback. They can use a search functionality, filter out certain patients. And also for our CPD platform as well, we've been able to add in the quiz functionality. So I'll take you through our team quickly in my remaining time. We've got our amazing CEO, Nicole. She's got a lot of experience across Africa and product and health tech background. We've also got Rita, who's our technical co-founder and has years of experience in development. Myself, I've introduced myself. We've got Stephanie, who's a medical doctor. She's our clinical lead. Victor heads our operations and again, bringing years of experience across the healthcare sector. And Virginia is our growth manager, again, with lots of years of experience in sales and marketing in the healthcare sector. So just to bring this all home, what are we saying? We've seen a lot of opportunities in the healthcare space in the midst of COVID. The landscape is just right. People are beginning to be accepting of this. People are beginning to ask questions. We've seen healthcare workers really open to using digital health, and we're excited that our platform is actually one of the ones that is building resilient health systems in the wake of COVID. And when you're building an innovation, it's not just for the sake of innovation. At the end of the day, it has to have the patient in mind. You must be improving quality of care for your patients. So when you're innovating, you must aim to improve quality of care. Collaboration, collaboration, collaboration. I'll hammer on about this. Collaboration is key. So what's the take-home message? We always say that necessity is the mother of invention. We've seen so many inventions coming out of this COVID experience, and just innovating and changing up, making iterations to our platforms. And really, the whole point is to strengthen the existing infrastructure and to build resilient systems for the future. So digital healthcare really is the way in which we're going to be able to have resilient health systems in the wake of COVID and even beyond. I thank you so much for listening, and I'm happy to take any of your questions. Thank you.
Thank you, Jean. Really, really insightful presentation there. And if I may say, just under 10 minutes, so bang on. Thank you very much.
I tried.
Thank you very much. Yeah, I actually forgot to stress before I introduced you, from people watching on the webinar, people watching on the Bobab platform, please feel free to fire your questions in. As they come in, I'll make a note of them and I'll put them to the relevant speaker or indeed to the entire panel, depending on what they are. Jean, I have a quick question for you, actually, because you mentioned the core sort of functionality of the product is to centralized doctor knowledge. And I imagine that involves a lot of sort of discussion and things like that. I wondered, in the context of global pandemics, obviously at the forefront of everyone's mind, whether or not there's a future iteration of the product that could leverage those conversations or pick up on certain symptoms or conditions being discussed that could be used to predict or potentially isolate incidences of disease outbreak. Is that something you guys have thought about or looked at?
Definitely. I mean, that is where the future is, and having all of this information. I mean, for you to start gathering those kinds of insights, you need a lot of data. And so, yes, we are working to get more facilities on board, more healthcare workers. Because if you imagine, if people had been using Medixus before the COVID-19 pandemic broke out, and you'd had 20 people start to mention these symptoms, or I'm getting people with fever, cough here, and you start to sort of map out where this is coming from, you're actually able to provide a lot of insights. So yeah, definitely predictive analysis is something that we have talked about and we're looking to do, and very excited about where that could lead, and working with organizations such as ministries and response as well.
Right, okay. And we've just actually had a question come in, and it's a broad one relevant to all the speakers, about from Philip Menzent, who's sorry if I've got your pronunciation on there. Can we hear about examples of ways of improving internet connectivity in rural communities? Now, that's a broad question and not necessarily one you can answer directly, because of course it's an infrastructural challenge, but in the context of what we just talked about, how important are the big telecom companies at engaging? Have you guys had any contact with those about how you reach harder to reach places, how you perhaps patch in some of the difficulties around access?
Yeah, it's a good question, Philip. Thanks for that. For sure, we have actually spoken with some of the large telco companies here in Kenya, and they were already looking for ways to boost connectivity, not necessarily for facilities. So what we've done is we've said to them, could you consider increasing connectivity for healthcare workers, for facilities? And they're actually on board. So what they do is they'd either provide data for the healthcare workers, depending on the number. If it's a small facility, or if it's a bigger facility, then they'd go in there. There's balloons. Certain telcos have partnered. You have the Google balloons flying over, and then they're able to increase the connectivity in those areas. So then you're just boosting the connectivity in the area. You're building the infrastructure, and you're making things better. So definitely conversations we've had, and actually looking forward to working on some projects like that in the new year.
Okay, all right. That'll probably be an interesting question to put to the rest of our panelists as well, just to get their insight on how they're engaging with that big fundamental challenge. And then one final one. I don't want to put you on the spot too much, but you mentioned it has had some sort of benefit in terms of regulations perhaps being sped up. Can you give us an example of one that's happened in Kenya that's perhaps helped your practice, or
sure.
any other?
Yeah, so we've had the Kenya Medical Practitioners and Dentists Council, which is the regulatory body here for healthcare workers, for facilities. They actually started on a case-by-case basis approving telemedicine digital health platform. So they were able to do over 40 digital health providers in a very short span of time. And basically what that involves is just filling out a form and then they give you approval. Something that would have taken years before was done within a matter of days. So indeed, we have seen goodwill from their part, and they've been acting very quickly, and we're working closely with them so that we can further the digital health agenda here in Kenya.
Cool. All right, great. That's really, really interesting. Thank you very much, Jean. A reminder to the audience as well, if you've got any specific questions for Jean, please feel free to put them in the chat. Just because her presentation is finished doesn't mean we can't ask questions still. So thanks so much, Jean. Right, we are now going to move on to our next speaker, who is Menyo Innocent. Menyo is a trained medical radiographer with a bachelor's degree in science and medical radiography from Makerere University in Kampala. He's something of a serial innovator. He's developed a number of exciting products, the most recent being M-Scan, a low-cost mobile ultrasound device that works on everyday laptops, tablets, and mobile phones. And on a personal note, Menyo, if I could say, as someone whose partner's just given birth, I'm acutely aware of the challenges and issues that come with, and worries that come with being an expectant parent. So thank you very much for all you're doing, and really looking forward to hearing your presentation. Over to you.
Thank you so much, Nick. I'll share my screen shortly. So once again, like you've heard, my name is Innocent Menyo, a medical radiographer by profession, and the founder at M-Scan Uganda. I present to you under the topic, the future of medtech in Africa, post-COVID, a case of M-Scan. A couple of definitions I would want the rest of the audience perhaps that does not understand what telemedicine is, e-health is, M-health is. Basically, when we talk about telemedicine, telehealth, it also means e-health or M-health, which is for mobile, M for the mobile. And here we're talking about talking to your doctor from a distance through phone calls, and they could be video chats, emails, or text messages. Telemedicine is also now being divided into two aspects. There is the inpatient and the outpatient. And for the inpatient, that's where doctors can communicate within the same health facility, but they do not necessarily have to be in the same room. A common example is with the PAC system. That's the picture caving and communication systems. This we use a lot in radiology to share an X-ray amongst physicians or radiologists in that sense. When it comes to the outpatient, which we are going to see that's growing, it comes to interacting with a patient in the field out there, or the patient in their homes, the patient wherever they stay, and you're able to give them medical advice and medical consultation. There is another aspect that's growing more so in Uganda. I've seen this a lot in Uganda, East Africa, and of course in the Western world, it's already been there. That's home care. With COVID-19, of course, we saw challenges like a curfew. We saw patients stranded, sub-Saharan Africa, failing to access health facilities because the transport was grounded. So home care is now where we are taking healthcare into the homes of the patients. And this is also disrupting because the hospitals are becoming full as we see the phase 2 of COVID-19 setting. So that's also another area for us to understand. So telemedicine, for me, it's also integrating into the home care, because even in the homes, we are using devices that are very portable and fit perfect in these non-conventional areas. If we may understand something I tried to look up, phase 1, phase 2, and phase 3 of COVID-19. In phase 1, at the start, of course, we saw that utilization of outpatient telehealth was very, very minimal. And as phase 1, we know that in phase 1, that's where heavy lockdowns were put onto people. We couldn't move. We were basically locked up in our homes. There were curfews, and because of the pandemic spreading at a terrific speed. When we reach the peak, we see the usage of outpatient telephone and video visits come to an increase and the peak because here patients are stranded, but they also need medical consultation. So we've seen a big increment when it was in phase 1. At the peak, of course, social distancing, people got used to, COVID-19. Being Africa, people were saying, Africa, you're not dying, our genes are resistant to all that. There was a lot of beliefs, and we saw that the social distancing was relaxed and basically curfew uplifted. So those who are trying to adjust to telemedicine or telehealth, the curve sort goes down. And this was basically due to relaxation in the lockdown, and people would now access the health facilities. As phase 2 of COVID-19 sets in, and I believe for my colleagues in Uganda, we are at this stage, and we are seeing that right now the hospitals are becoming full of COVID patients, and an admission is very, very hard to achieve. In the private sector, you pay a ton of about 10 Ugandan million shillings to just be admitted in a health facility in Uganda. So we see that it's the hospitals are becoming very full. But at the start, we would see that there was limited utilization of inpatient telehealth. But now as hospitals become full, also the doctors protecting the health workers, we're trying to use telehealth to see that we reduce on the active interaction with patients. So this is going to a peak in the inpatient virtual consults. And as we see the second wave, take shape, it will definitely take a surge as the inpatient telehealth becomes a new billable service line intimately. We know the health funding and the out-of-pocket expenditure of Africans is not that much. So as this becomes part of the out-pocket expense, because hospitals certainly have to use this to basically fill up on this new development. So we shall definitely see a big surge. And when it comes to the phase 3, where patients, the health facilities are crowded, and now patients are being managed from homes, we see the growth still a late growth setting, but we see that still patients will need telemedicine. They will need consultations from physicians from a distance, and we hope telemedicine goes at a spike for us who are in the space. Hope that throws a lot of light regarding that. One of the biggest challenges, of course, that we look at is the health financing, in particular telehealth. This is a global projection, and we see that by 2026, it will be at about 185 billion US dollars. But when it comes to the market share for Africa, it's about only 2%, which is around 5.25% billion US dollars. That's still small because the space is growing, and this is bringing up conversations on investment into the space because the markets are actually appreciating this, especially in the market space where I am speaking from. People are seeing the need for telehealth. People are fearing hospitals, a lot of social challenges. People are fearing to contract COVID-19 because it's so scary at the hospitals right now. So this calls for more telehealth financing, to better the projections, especially for Africa that stands at 2% of the global telemedicine market size. What's the case for MScan? After understanding all this background, the maternal health is increasing on a daily. Before COVID, we were at 16 mothers dying every day due to complications related to pregnancy. And with COVID, the statistics are blurry, but we know that the maternal mortality and infant mortality rates are on a spike. And we know that the World Health Organization recommends ultrasound, a minimum of at least 4 ultrasound scans in pregnancy. So we know that most of the complications can indeed be detected using ultrasound. So as MScan, we've been challenged to develop portable ultrasound machines that apply both in the conventional and in the non-conventional spaces to be able to achieve ultrasound. What we do is we detect risk factors of maternal mortality and have these mothers referred on time. These are our devices. The ultrasound probes can work on a tablet, they can work on a laptop, they can also work on a mobile phone. And with the findings, we basically communicate with our team of doctors and also with the different hospitals we are connected to channel our patients to them. Of course, the market size in Uganda alone, there are over 5,000 private clinics and 2,400 health center threes, and we are currently working with 10 private clinics and 6 health center threes. We've been in talks, of course, to expand to Kenya, and we have a distributorship model already in Kenya, and engaging about 5 hospitals to be able to sell to and work with them using our ultrasound devices. Of course, with the wake of COVID-19, like earlier, I talked of the fact that patients are finding challenges to access health facilities. We were still challenged to now take medical services into the patient's homes, what we earlier talked about as the home care. And with this, our devices being portable, being power efficient, and working on everyday laptops, tablets, and mobile phones, we've built now a model where a patient makes an appointment with us, and we're able to use our bikes and our transport systems. We go to their homes, do an ultrasound scan. If a complication is detected, we connect them to our team of doctors. Sometimes, based on the history provided during making of an appointment, we move with our team of doctors. But these being non-emergency ultrasound scans, most of the patients that have been approaching us, we go scan them. Sometimes we detect complications that perhaps these patients didn't know that they were having. So we refer them on time and have the baby salvaged and the life of the mother and that of the baby saved. And the projections, of course, are good in terms of the numbers, in terms of the impact, and also in terms of the revenue. This brings us to our traction from the start, where we started with just a software that would draw fetal graphs, and we know pretty much it was a fetal tachocardiogram that we made ourselves, where we just detect the fetal heart rate. But we had to move to detect the real form of an image in utero and detect complication out of this image, which is the ultrasound, and a real-time ultrasound where we are able to see organs in real time. Of course, our impact, we've scanned to date a number of pregnant women totaling to 700. With the telehealth, it's coming to 800 and detected over those complications. These are the districts that we've impacted in. Again, with the home care, we see that we are able to reach the patient in districts that are also stranded. Someone talked about the challenges with internet connection. Home care is one of those that, trying to bridge this gap. Whereas patients might want to access these services, some of them don't have the capacity to connect to make virtual connects with doctors in health facilities. So we are seeing that home care is actually building a lot of impact, both in the urban, peri-urban, and also in the rural facilities. And with this, we are seeing this us expanding our impact across Uganda in particular. Again, like the earlier speaker talked about, talking about strengthening partnerships. We strengthening our partnerships we're currently working with Johnson & Johnson, Outbox, the UN, YGAP, and also Sono AI, where we're trying to integrate artificial intelligence and ultrasound to boost the accuracy of our systems. This is the team, myself, the lead, Dr. Prosper, a medical doctor. We have systems experts, Ivan and Joel, and of course, business strategy, and Phyllis. We also work with a radiologist, Dr. Rosemary, and an obstetrician. I would want to end by saying that this is one of the mothers that, of course, was saved using the ultrasound devices. The complication detected early, the mother referred early on time, and the baby and the mother, we have them smiling. In the future, we are going to see that we might not prescribe drugs. We might actually prescribe applications to see that patients get the right medical care. I believe, for me, that no mother deserves to die, even in the wake of COVID-19. I know mothers are stranded, but I believe no mother deserves to die while giving birth. EMS can save a mother, save a life. Thank you so much for listening in.
Thank you very much, Innocent. And what a salient message to end on. I think we can all agree with that. Absolutely fascinating discussion, absolutely fascinating interaction between digital and some really smart hardware as well. I have, again, I have lots of questions. Your business model going forward, is it a case that you will employ a team of doctors or pediatricians, or obstetricians who will be sent out with your devices, or is it a case that you can sell your devices to other doctors and they can use it independent of MScan? Just curious to know how that's going to move forward for you guys, or if I misunderstood, apologies.
Thanks, Nick, for that. So we work through three business models. One is the direct sell, where we sell the devices to clinics, hospitals, and also freelance doctors and radiologists. But of course, we always make sure that there is some quality assurance to it. We make sure that the doctor or the radiologist has the credentials to do an ultrasound scan. Of course, there is a rise in point of care ultrasound, and many people are being trained on how to do ultrasound scan, but we make sure that someone has the capacity and have been approved and certified to do ultrasound scan. So when it comes to the home care, depending on what the patient feeds in during the appointment, scheduling of the appointment, if it's just a routine scan, we don't need to move with a team of doctors. If the patient rather talks about a scary history, say they've had cases where the placenta has been in the womb of the baby, placenta previa to say, then we usually walk in with our team of doctors and they do an examination at their homes of comfort, and then we do the ultrasound scan so that we make sure that there's no emergence that comes up as we are in the patient's home.
Fascinating. Okay, really interesting. Well, that was kind of my next question, really, because I imagine this goes hand in hand with good training, doesn't it, of ultrasound and radiographers. So, great to hear that you guys are maintaining a high level of standard as well. We have a couple of questions coming for you, Innocent. First one from Mike Raxworthy, who has asked, what is the medical insurance company's view of telehealth and home-based services? Are they engaged? What's your experience of engaging with insurance companies?
Absolutely. So MScan, we've talked to one of the insurance companies in Uganda called Minet Uganda. Of course, it's also in Kenya and basically a Pan-African insurance firm. And they're very positive about it, but they want to understand the numbers to the granular level. How do they come in? Does this, reduce on the premiums at the end of the day for them? And are they in business? So the insurance firms are up for engaging with telehealth companies for as long as you prove that the numbers actually are positive on their end and also on your side. So it's up for conversation with insurance firms. And for MScan, we've already started one with Minet Uganda and hope to have something come up with them.
Interesting. All right, fantastic. That's good to know. And then we have another question from Philip. Thank you very much for your engagement, Philip. We really appreciate it. He has given you a compliment, Innocent. He says, wonderful project with so many children impacted by birth complications. Is the Ugandan Ministry of Health showing interest in this technology? Are you engaged with any government departments on rollout or adoption?
Thanks so much, Philip. Yes, indeed, we are. We are in touch with Ministry of Health, and actually this year, when COVID hit, the point of care or the portable ultrasound machines proved again that they offer less cross-contamination, and they are also very cost-effective for hospitals to acquire because, hospitals face challenges of financing. Patients are no longer coming to hospitals. So even when it comes to the technology, the medtech, they had to go for cheaper options. And as such, we've gotten an award from Ministry of Health Uganda as the Innovator of the Year, and they're willing and open to support us. We've run a pilot and presented to them on the impact of this in a low resource setting. That's Buko district in Sebei sub-region at the border of Uganda and Kenya. We've proven that this actually works. When you train midwives, this works. So ministry is up for this. We are also very soon going to launch a pilot with them. So it's good news for us that we are working with the regulator themselves than having the regulator having to be on our cases on if this is actually something that's very credible. So we are getting a lot of validation from them. And again, on the issue of the internet, when we piloted in Buko, realized the internet was very, very bad. So we had to get Airtel Uganda, one of the leading telcos in Uganda, we worked with them through a partnership, and we've implemented a project and a pilot with them in Buko district, and they've come to also understand, the challenges in terms of internet coverage, and these are some of the discussions that innovators are able to drive. So we are driving the telcos to improve the internet coverage, because without the internet, indeed, telehealth, can't come to can't come to a success and is all in vain. So we are working with the telcos. We're also working with regulators like Ministry of Health.
I see. Fantastic. Thank you very much for referring back to that other question from Philip about infrastructure, because it's going to be an ongoing theme, I think, going forward, isn't it?
Yeah, sure.
Well, that in lots of ways, you represent a demand for better maternal health care in rural settings, and that demand drives supply and engagement with telcos. So that's really good to hear you're working with them so closely. Thank you so much for that. Again, don't if you've got any more questions for Innocent, feel free to fire away. I'll be keeping an eye on the chat. But next we are going to go to our next. Thank you very much, Innocent, I should say. Next we're going to go to our next speaker. I'd like to introduce Shafiq Sakito. He is the VP of Business Development at Matibabu and Think IT, a technology and experience disruptor that, amongst other solutions, has launched Yotta, a platform aimed at providing real-time data on disease surveillance. Shafiq, thanks again for joining us. Great to have you with us. Over to you.
Thanks, Nick, and thanks everyone who's listening in. I'll share my screen. So at Think IT Limited, we aim to bridge the gap between communities and the rightful access to health. And for the past few years, we've been working to have diagnosis devices for malaria deployed in sub-Saharan Africa. And this device for diagnosis is the Matibabu. Matibabu is a device that can diagnose for malaria in less than 2 minutes and without having a lot of medical knowledge to operate. And in our journey deploying Matibabu, we realized that there is a big gap in data. So we've been trying to tackle the way we diagnose malaria, but it seems with other researchers can give more information on this. It seems that the parasite keeps on changing, and somehow it's getting harder and harder to tackle it. Many efforts are being put to trying to have a vaccine and all that, but without accurate data, we think it may also be a great hurdle a big hurdle to get to that point. So along with our Matibabu device, we are trying to obtain proper surveillance for this disease. Oh, excuse me a little. Sorry about that. So we are trying to get proper surveillance tools for malaria. And so far we've tried to deploy the Yotta application in 60 health centers in Uganda. And why are we doing this? So we are trying to help governments, help pharma companies, help insurance companies, help decision makers and other stakeholders in the medical field on prediction of disease outbreaks and all that. So narrowing back to the COVID-19, we feel this could be also something useful if we can be able to detect which areas are having many incidences or many cases. And we feel we can use this app because right now we're doing it for malaria, but we are picking very many data points, speaking also in the point of future personalized medicine, where we will we'll have medicines that are customized specifically for a patient. So we've seen the Western world trying to get there, and I think some of the vaccine, the COVID-19 vaccine research has been delayed due to such issues. And we feel with such data being obtained, we can be able to personalize medication. We've had cases where vaccines are deployed here in Uganda, and people are having diverse side effects. So we feel with this data, we can be able to also come up with personalized vaccines and medication, not only for malaria, but many other diseases. So with the 60 hospitals we've managed to work with so far, they're in 4 different regions. That's Eastern Uganda, the West, some hospitals here in the Central. They are really excited to have such a surveillance tool integrated into their systems, because currently the data surveillance tools being used are paper-based, and they're not giving real-time data. They're not having personalized data. It's just aggregated data which comes in maybe 2 to 3 months after. So we approached the Ministry of Health here in Uganda, and we managed to obtain the necessary approvals, and starting, I think, January next year, we're trying to scale up and have more hospitals join the platform. And also we've gotten a few links to Rwanda, where we also want to pilot the same kind of technology. And the total addressable market is really big. It's not only in Uganda, like I said. We are trying to get into Rwanda, and I think we can have the same in sub-Saharan Africa. Like I mentioned earlier, governments can be able to define their policies well, to know where to put the right medical intervention with tools like Yota. Then for the pharma companies, they can really focus on what kinds of medicine and where to sell their medicine. And for researchers, they can build on what kind of data we have. Like I said, we have over 50 data points in just one collection. And also insurance companies can be able to know who to charge more, what are the risk areas, and things like that. Yes, I think for our partners, we are working still with a few pharma companies and universities to make sure we can deploy more and scale this tool better. And thank you. I think that's it for my presentation today.
Thank you very much, Shafiq. Short but sweet presentation. Excellent. That's what we like. Thank you very much. And no problem about the child in the background. I think this is lockdown life now, isn't it? And we're all used to juggling childcare and work. So no problem. Thanks again. Again, I've got lots of questions from my side, but I'd encourage our audience to fire any questions at you as well. In the meantime, just a little bit more on the use of surge data, if you wouldn't mind elaborating. Are we talking here about specific outbreaks within communities, or is it specific perhaps evolutions or mutations of disease that mean you give you better data sets to provide more accurate medicines or vaccinations? Is that, am I understanding it right?
That's absolutely right, and it's more to that because if I can get information on, let's say, one patient, and I get to know that maybe this patient often gets malaria, maybe in 3 times a year or during this season. Somehow I can derive patterns and maybe predict when this person is going to get sick again, or why they are getting sick during this specific kind of time. And then we also pick what kind of medication has been given to them. And we also get to know, did they cure? We go up to that kind of detail. Did they cure when they were given this medication? If yes, then that's good. If no, why? Why didn't they cure? We always go back to these health professionals. We tell them to give feedback, and if they didn't cure, what new medications did you give them? So somehow over time you can use such data to know what kinds of people or what genotypes are reacting to what kind of medication, and such information can help inform researchers on how to administer the best medication or vaccines. So
okay, and that's really interesting, and this can be applied to lots of different diseases, which is of course great. In the context of I guess malaria versus COVID, because as we know across the world, COVID has pushed a lot of other critical disease prevention and care to the back of the queue. I just wonder, in terms of your experience, you're engaging with hospitals all the time, are people still giving things like really serious diseases like malaria attention and time, or is it a case that a lot of resources are being diverted by COVID and you're not able to do as much as you like with malaria? How's it playing out in that context?
Yes, actually, that's quite true. A lot of effort is now being pushed down to COVID, and somehow we've also tried to somehow work towards that side. So we partnered with the Royal Academy of Engineering, and we are currently manufacturing PPE, which we are also deploying to these health centers. So once we go to the field and we are doing our malaria side, then we also try to give them these PPEs to try to protect the health professionals and the few inpatients that are there. Yes, so somehow that's true. The effort has been pushed to COVID, but we do not ignore the fact that malaria kills, I don't know, it's now like a child every like 5 minutes. So the COVID is there, and since now even it has similar symptoms. Malaria has a few similar symptoms to COVID, so we do not back off. We do not. We are not backing off. Like if many people now fear to go to the health centers because they know when I have a high temperature, I have a fever, or they may say it's COVID, and like it's worrying. So somehow we are trying to have the better, faster diagnosis. Okay, that you can rule out malaria quickly, and then maybe concentrate later on COVID. Yeah.
Okay, and we've got a question from an anonymous attendee, mysterious, who asks, do you see your technology being used in understanding the impact, success of a COVID vaccine on African or your patient population, and how quickly can you get insights from the data, or how large are the data sets? How large is a data set required for meaningful population level insights?
Yeah, for the first question, yes, it really can. The tools can be used to know whether a vaccine is going to work, because there's been many I don't know how to call them. At the beginning of the pandemic, people are like, oh, people in Africa, they're having strong genes, they're not getting the disease. And then thereafter, the cases are on a rise, but still there is that question, like, why we having more deaths? Because the cases are there, but our deaths are not surpassing those in maybe Europe or the US, and somehow we feel that it may be the genotype, and we are yet to find out, like, yeah. So I'm thinking the tool can be applied in that way. If the vaccine is deployed, we can use that tool to know, okay, maybe this amount or this number of people have been administered, and what's the effect. Yeah, we can use that tool to capture that. And the second question was, could you remind me a little?
Yeah, so it was, where are we? How quickly can you get insights from the data, and how large a data set is required for meaningful population level insights? So you're working in 60 hospitals. Is that giving you, a sufficient blanket oversight for Uganda? Or are you going to need to extend that further to get really good insights at a population national level?
Yes, so we need have it deployed at least today. At the end of the day, it's a simple to use application. The health professional will pick the smartphone and just take a picture, and automatically we're using something called template matching. So automatically all that data is picked on the form and uploaded to our servers. And with this, we feel when we get this data, we feel like maybe we need some more hospitals, because 60 is not enough. Like I say, the total addressable market is big. 60 is not enough, but for a specific region, because we were targeting districts. When you look at our dashboard, you can be able to see that there are some regions that are having more cases than the others. Then when you look at maybe things like age, sex, yeah, there's lots of data points. I can't say we really have made sense out of all the data. We are just picking it for now, and we are looking to make more sense out of it to be able to define like what direction to take. But
Okay.
at least we are picking all of them. We're not leaving out others. Yeah.
All right, fantastic, very interesting. I've got a couple more questions, but I'll leave it for now, so we can answer them later. But we're going to move now to our next speaker, who is joining us from Nigeria. I'd like to introduce Dr. Suwan Odiasa, who is the CTO at Telehealth. Suwan is a qualified medical doctor with a keen interest in the practical application of technology in both clinical and commercial settings. Telemus, which is active in Ghana, Nigeria, and South Africa, has developed a mobile-first healthcare platform that allows patients to make physical and video appointments with doctors, receive appointment reminders and laboratory and imaging results, organize medication, store medical records, and pay medical bills, all from their phone. Wow. So, thanks very much for joining us. Really looking forward to hearing from your presentation. Over to you.
Hi, Nick. Thank you very much for this platform also. Thank you for the opportunity. To the other panelists, very interesting products and services. Hope to catch up immediately after this.
Oh, Doctor, sorry, Seun, you're very quiet. Would you mind?
Can you hear me now?
Yes.
Is it better now? Okay. All right.
Thanks.
So thanking everyone for the platform, and to the panelists also, wonderful products and services. I'm sure we'll catch up immediately after this. Thank you also to the attendees. I'll be sharing my screen now. Okay. Okay, so we at Talamus, we are a mobile healthcare platform. We work across 4 countries in Africa. We currently have solutions that range from inventory management to electronic medical records, also to insurance claim services. So basically what we're trying to do is bridge the gap between healthcare providers and healthcare services. Most times when people speak about healthcare providers, the focus is usually on doctors. But for Thalamus, we decided to analyze the whole ecosystem. So we have people from the doctor to the patients to pharmacies to people that work in insurance companies, the inventory, people that radiographers, lab technicians, lab officers, basically. So from our previous experience, we realized that there's a certain ecosystem that's peculiar in most countries in Africa. Because our focus isn't really on Nigeria, our focus basically is on a global scale. We tend to tackle each problem one by one in different locations. So basically, this looks very disrupted, where we have the doctor and the patient. We have patients having issues with connecting to clinics or finding doctors or even booking appointments or even getting to those facilities. We have issues with pharmacies, keeping track of their medications, inventory management, keeping stock, supplies, and all that. Then for also the insurance companies to how to accumulate their claims, for hospitals sending in their insurance claims to the insurance companies. We also have issues with radiographers, basically where you have, which is very interesting with Mr. Menu on M-Scan, where basically being able to take radiology investigations remotely. For Thalamus, what we have is a mobile tool also, which allows you to basically take a picture or a video after having your scan. So this is the picture we have basically for Thalamus. We tend to digitize healthcare practices across Africa. We call it our Smart Health Information Platform, where we have digital pharmacies, Telemedicine Plus. The reason why we added a plus is because we offer these same services to the insurance companies. It helps them to adjust their plans, helps to reduce hospital visits. And also for those who aren't online or who don't have access to internet, we also have a call center to help them pass through these phases. We managed to set up hubs in different remote areas or communities, which is easier for people in remote locations to actually reach out to us also to have access to healthcare. We structure billings and payments, insurance claim management, reporting and analytics, where we have basically about 15 different indices that can be captured from patients' data, number of patients that visit the hospital, number of patients that even visit the pharmacy. Basically, at each station, you can get population count. This also leads to symptom checker, capturing symptoms from patients. Also, in terms of revenue and billing, we also capture that data. The best part of it, which was in relation to COVID-19, was actually having a heat map. So with our data, we're able to extrapolate the hot zones basically in different regions in Nigeria here. And we're able to know, we have a partnership with the government. So it was very easy for us to deploy in those facilities and know which locations require medications or quick access to healthcare. So just an overview of Thalamus. Thalamus is a mobile health platform. It was founded by a neurosurgeon who's Dr. Muri Raifu. He's a neurosurgeon based in the US. Some of our awards previously in 2018, we won the United Nations ITU award as the most scalable SME. We're also listed as Fast Company's most innovative companies in 2019. Currently, we have about 1,000 facilities in different capacities at the community level, at the secondary care level, and at tertiary care level across Nigeria, Ghana, South Africa, and Zimbabwe. I decided to start with an overview of the public health systems. Surprisingly, yes, Nigeria has a very weak public health system. The reason is because there are so many projects that have been done here, but the problem
Oh, Sharon, we seem to have lost you. Can you hear us?
most countries,
Okay, you're back now. Okay, looks like we've lost connection with Dr. Shayon, but not to worry. Hopefully we'll be able to get him back soon. Shayon, can you hear us? How's your connection looking? If not, Brian, we might move on to you next, and then we'll come back to Dr. Shayon when he has his connection back. No, doesn't look like it. Okay, not to worry. Dr. Shayon, we'll come back to you if we may. Brian Mwenda, are you there? Hello.
Hi, Nick.
Hi, Brian. Sorry, slightly earlier than planned, but such is the fate of an online event. I think we'll go straight to your presentation if that's okay. So I'll introduce you, and then we'll come back to Shayon. Yes, so Brian, CEO of Hope Tech Plus, a medical technology company that creates assistive devices for visually impaired people to enable them to experience freedom of movement, helping increase participation in society as well as access to education, employment, and social activities. Brian, over to you.
Thanks, Nick. Hi, everyone. My name is Brian Mwenda, and I'm very excited to show you the work today that we do to create the future of mobility for visually impaired people, not only here in Nairobi, Kenya, where we are based, but also the rest of the world. So Hope Tech Plus is a tech company, is a medtech company, and we primarily develop assistive devices that help visually impaired people to integrate into the society. We're focusing on increasing their participation in employment, in entrepreneurship, education, and social activities. Basically, we want to give visually impaired people the power to go into the society and create a meaningful and dignified way of living. So there are over 285 million visually impaired people globally, and this is data from like 10 years ago, and the number has really grown. And when you look at some of the marginalized sectors in the society, I think visually impaired people are very marginalized when it comes to development. For example, when you look at mobility, I think since the first person became visually impaired, they've always had access to just a white cane. So this is the challenge that we identified. We realized that even with the white cane, visually impaired people still needed another human guide to help them to move around. So we went about to create a solution that can help free visually impaired people from relying on another person for mobility, because when you have to rely on another person for mobility, then it's very difficult to make independent choices to basically participate in many activities. So 3 years ago, we came together, we formed a team, and we decided to launch a product. So one of the products that we launched in partnership with some friends from India, it's called the Fourth Eye device. And it's a product that uses echolocation technology to detect obstacles. And once an obstacle is detected, then the feedback to the user is through vibrations. So the device, you basically will be working with the device like a flashlight, and it will be vibrating for any kind of obstacle that is in front of you. So this particular device is compatible with any white cane out there, and it can convert any white cane into a smart cane. So that was the main selling point for this particular product. So we currently have over 1,600 people using this device in Kenya. It's being used in the rural areas, in urban areas, and in many other places. But we realized still that this device is not enough to completely give that feeling of security and freedom to someone who is visually impaired. And also it's not very scalable to other parts of the world. So we decided to develop something which is much more advanced. Some of the challenges that we identified were that the environment is very complex, and using a very simple technology to detect the obstacles will just not be sufficient for the changes that happen in the environment. I mean, things are moving every single time. There's various obstacles. So if there's a device that can solve this problem, it has to be able to accommodate this type of dynamic environments. So we brought together a group of visually impaired people, and we asked them an ideal product to visualize an ideal product, and from that we worked down to the product. I think the main point we got was, what if there's a product that can help someone to walk freely through a city street, and they could understand the environment through touch, and also they could cross the street without necessarily using the white cane, because we realized there's a lot of discrimination associated with using the white canes. And then safety was a big issue. Someone really needed to feel safe in that freedom that we are promising. So that's when we developed now the Sixth Sense, which is a fully wearable device that helps someone who's visually impaired to get rid of the white cane, to get rid of human guides, and become completely independent. So it's a chest-mounted device, and then there are 2 bracelets. So the device works in combination with, there's a sensor module, and then there's the feedback module. We've worked really hard to incorporate all kinds of obstacles into the product. We're feeding this device with different kinds of environments so that it can learn the different obstacles. And also we have different warnings for different dangers that may present themselves in front of the users. So the device is very intuitive to use, especially for people who've recently lost their sight. So it's more, I think it's more familiar to what they were used to before. And it's very lightweight. It enables them to, they can use their hands for other things. And then other users explained using the white stickers, waving a flag and telling everyone you're blind and helpless. So that feeling was not desirable. And with this device, it's discreet, and someone can comfortably walk without feeling that everyone is paying a lot of attention to them. So we're using computer vision to differentiate different kinds of obstacles. So someone can get different haptic feedback for different kinds of obstacles. They can differentiate between the trees and the people in front of them. So when compared to other things in the marketplace, other solutions for this kind of a problem, we realize that the Sixth Sense is the only one which can do very complex functions similar to what a human guide can tell the user. And then we're maintaining a very low cost. So we are retailing at $500 compared to other solutions which go up to $10,000 and can only be used by people who have low vision. So we believe we have the right product offering and the right technology for this kind of problem. So in terms of scalability, this product has a lot of potential to scale, and we even have ideas of making some of the development open source in future. For example, it can integrate into apps like mobility apps like Uber. It can offer navigation to someone who is visually impaired, and we're looking at adding many other cool features and platform for future developments. So I think most of our work over the last 3 years has been made possible by some amazing partners who've come and helped us to do user trials to reach many visually impaired people across different parts of the world. And so far we've had trials in over 6 different countries, and we're looking to launch here in Kenya, in the UK, and in Australia in the next 1 year. And we believe through these kinds of partnerships, we can really transform how visually impaired people interact in the society in these different places that we are launching. So in terms of the impacts, we are looking at impacting over 1 million visually impaired people directly in the year 2030, and we believe this kind of ripple effect will translate to their families, to their colleagues, and we'll definitely see a lot of change in this space. If there's a message I could leave today is, even for the other entrepreneurs working in similar spaces, developing products, let's think of like the accessibility side of every innovation. So let's not make innovations that can bar a certain group in the society from accessing them, and then in future we come back to innovate now for inclusion. So right from the start, I think inclusive design should be something that every single solution out there should have. So these are my contacts. So we're looking at collaborations, anyone who can help us to do user trials in any country. because we are looking at this product being used globally. Please feel free to reach out. Thank you.
Thank you very much indeed, Brian. Wow, can I just say, I hadn't actually seen it up close, but that Sixth Sense chest-mounted device is seriously cool piece of tech. So well done to you and all the team for developing it. Because yeah, I hadn't fully appreciated the stigma associated with the white cane, but of course it is something of a target on the back, isn't it? Exposing vulnerability, and that just seems like a fantastic message to round off your presentation on, which is innovate for inclusion. And I think that's something we can all do with bearing in mind a bit more often. So thanks for that. I've got an absolute ton of questions for you, but I'm going to wait until we've heard from Shayan, who I believe is back with us now. Shayan, are you there?
Yeah. Apologies, Nick. Thanks for bringing me back in.
These things happen, don't they?
Yeah.
If you're okay, we'll just pick up from where you left off.
Okay, then. Thank you.
Sorry, Shane, I'm not sure if we're having more
Can you see my screen?
I'm not sure if you can hear us. We can't see your screen though, I'm afraid.
Oh, really? I've started sharing my screen.
Oh, there we go.
Okay, good.
Thank you.
Okay. Okay. All good?
Yeah.
Okay. Yes. So apologies to everyone. So state of healthcare, basically, I was talking about community healthcare in the community level. And then we realized that there's a big problem at Thalamus big problem in Africa, basically at the community level. In 2016, this survey was done, which actually showed that the top 5 causes of death in Africa are lower respiratory tract infections, HIV and AIDS, diarrhea diseases, heart diseases, and malaria. But the major reason for this data is to show you that basically healthcare in Africa has a long way to go. Currently, now we have the ischemic heart disease, and we basically don't really have access to care, and there are poor monitoring services, which is the reason why in Thalamus Healthcare we decided to have a solution which allows people to basically be monitored from home or in the facility. That was the essence of having big data basically on our platform. So I'll head straight to challenges in the COVID-19. And for COVID-19, that the major issue again is people having access to care. We realized that for COVID-19 itself, some other diseases were actually ignored. So we had diseases like basically people that were hypertensive, people that had other kinds of diabetes, people that had other kinds of illnesses. In fact, like the previous speaker spoke on malaria, that's Shafiq, who mentioned the issue of malaria having to COVID-19. So a lot of cases were actually ignored because everybody thought everything was COVID-19. So then COVID-19 itself was a big problem. Access to information was a big problem, access to care. Then having data and predictive tools basically was a big problem. In terms of Africa on the global scale, we had issues here in Nigeria, pertaining to Nigeria too, logistics. So basically getting health packs to people. In Lagos here in Nigeria, we had to do medipacks, which is what we called it. So they had medications in it, paracetamols, other medications, just basic needs for people to take at home, anti-malaria medications and all that. We also had an issue with tracking symptoms and triaging, which is where telemedicine came as a very strong point for us. Inventory management. So the government had an issue with tracking what was being supplied to who and who was keeping account of what. Then insufficient equipment, which was another issue, another challenge that we had. Then we had to give people information. So that was basically getting news updates and differentiating fake news from real facts. Access to care, where we had much more COVID-19 and other somatic illnesses that were poorly being monitored. Then there was a big issue with mental health. So we had a lot of people with anxiety, depression, basically mental health. We realized that mental health was becoming a challenge. So some were even presenting with symptoms that were similar to practical diseases, but realized that basically it was more of a psychological thing. We had a problem with data analytics where this is highly populated. Lagos has a population of more than 20 million. Nigeria has more than 200 million people. So basically, that's big data for any company or any government. We realized that basically we need to identify the hot zones, number of cases, and predictive tools. These features were actually available, but how would I say it now? Let's say the COVID-19 created an enabling environment for Thalamus where we could actually display most of these features. We've had these features for over 2 years prior to the pandemic, but due to professionals or government bodies not seeing the essence of having big data or having be able to accumulate this information in one platform, that became an issue previously. But with COVID-19, we were the first point of call, and people basically were trying to reach out to us to offer them telemedicine services, offer them data, and also to try help them to procure equipment and manage their systems, basically. So technology generally gave birth to different kinds of innovation. What Thalamus does is our Thalamus Classic. It is a mobile healthcare platform. It allows the doctor, the nurse, there are 9 interfaces actually, which also includes the patient. So patients can also download our application. They can seek admission, and there's a bed space availability, so which actually saves time. So the patient can actually view any facility or any government hospital or any private hospital that's within our network and basically know which one has bed spaces. This is then linked to an ambulance service, which then takes the patient straight to the facility, and it gives so much detail where the spaces. It also gives you, so you can know if there are 2 bed spaces in the male ward or the surgical ward, different types basically. You're able to book appointments through our platform. We offered inventory management solutions to hospitals. Our digitized record system allowed nurses to take vitals remotely. We have a COVID-19 assessment form that is already in our mobile application. It's WHO certified. We had our essential drug list, which the doctors, the farm techs, and also provide medications to people in the populace, or also to distribute medications to people. We also provided people with social media and online trainings for healthcare professionals and also for the general populace through our telemedicine platform, which included video call services, our text messaging services. We also did social media and email marketing too. Our telemedicine service allowed for not just consultations between doctor and the patient. Our platform also allows you to have consultations between 2 medical professionals. So 2 doctors can decide to call each other. You can call a radiologist, can call any other healthcare professional there. Our mental health services also went a long way. So apart from just on the physical patients that actually needed somatic treatments, we also have people that had provided counseling and mental health support to patients. Telemedicine also helped us to basically triage patients to know which patients actually will be better treated at home, which patients are high risk, low risk. Patients can also input their symptoms from the patient application to choose who gets to come. Also, we had a symptoms checker, which helps patients to actually, when they put in one or 2 of their symptoms, it's easier for them to basically know whether they are high risk or low risk. We offered database management tips too, and also heat maps. So for database management, we actually could capture about 15 or 16 different indices, from number of patients seen, how many insurance patients we're seeing, how many consumables with. Basically, a very big dashboard, which allows you to view all these things by time, by age, by sex. You can even know how many patients a particular doctor sees in a day. You can basically different demographics. Then what we explored was a partnership with the company on 3D printing because there was an early need for ventilators, and we explored the avenue of having 3D printed materials up to face masks and ventilators and other medical equipment. On Telehealth healthcare platform, which is available on the iOS and Android Play stores. If you download the application now from the Play Store, you actually be downloading it as a patient. If you're a healthcare facility or a healthcare professional, we have to create a profile for you, send a mail, and then we create a profile for you as a facility or as a healthcare professional. We've gone across more than 1,000 facilities across Africa. We have a lot more penetration from Nigeria and Ghana. South Africa, we work with one of the largest insurance companies there, which is Discovery. We're planning to move into East Africa with some of the telcos, because we realize that telcos are highly needed in terms of internet penetration and also dissemination of information to the populace. So basically, this is an overview of Thalamus. We have a partnership here with Microsoft. We use the cloud service. We also have a partnership with an association which basically comprises of all the private healthcare professionals in Nigeria. Then we're across 22 states out of the 36 in Nigeria, 4 African countries, and makes healthcare very easy and creates a very good network for interaction between different healthcare professionals. This is just an overview of Thalamus in the news, from Fast Company to our first mobile healthcare platform. This basically...
I'm okay. So
this is our team. Yeah. So yeah, this is the team, and basically I'm Chief Technology Officer. And thank you very much, guys.
Thank you very much, Shane, and thank you very much for persevering with technology issues. It's the sign of the times we live in.
Thank you.
That was great. Really, really interesting and incredible piece of kit. A real turnkey solution for lots of prevalent challenges. And it was really interesting to hear you talk there actually about the integration of mental health as well. I think certainly in my experience of working in African public health, only quite recently have people started actually talking seriously about mental health. There's still big issues in terms of treatment and care, but hopefully, work by organizations like yours is helping to shine a light on the comorbidity that exists between infectious or non-communicable diseases and long-term chronic mental illness as well, which is something perhaps we can chat about a little bit later on. Right, I'm afraid we haven't got an awful lot of time left, so I'm going to fire. But we've actually got a couple of questions for Brian, and then I'm going to open some questions to the panel very quickly. Just a brief reminder to our panel, just so we can get through a couple more questions. If you could keep your answers succinct, that'd be wonderful. But first, Brian, because we had to move on so quickly, we have a question from you, from an attendee that is about how many people are using your hardware devices at the moment?
Yeah, so thanks for that. So currently, there's the first version of the product that I showed. So that's what we have in the market. So we have over 1,600 people using that. For the new product, right now we're going into intensive user trials over the next 1 year because we're getting a higher classification of a medical device. So we need to do lots of user trials, and we're getting lots of partners on board for that. So for that one, we're looking at launching by the end of 2021.
Right, I see. Okay, fantastic, great. So you guys, I imagine COVID probably did something to slow you down a little bit, as it did with almost every business in the world, I think. But that's really exciting. Within Africa, are there, outside of Kenya, are there particular markets you want to go after? Around the world, is there particular markets you're keen to penetrate?
Yeah, so we've gotten lots of partners from the UK, and we're doing most of the product development in Australia. So naturally, those are our 2 markets to launch in. And of course, here in Nairobi, we've done a lot of trials. We're going to make the product available, but we're focusing on hitting the ground running in the UK and in Australia, then now scaling through Europe and the rest of other countries. Yeah.
Okay, and just out of curiosity, because well, I imagine the price point, as you said, was very good compared to other more sophisticated site assisting technology, but still, you know, there's still a price tag to it, which some people won't be able to achieve. Are you looking to collaborate also with perhaps charities or development organizations who can help cover the cost of some of the products, or is it purely straight to market, consumer market?
Yeah, so with our current products, we're using that model where we work with charities work with government through social protection. But with the new product, we're looking at selling directly. And we believe in the markets that we're launching, similar products have performed very well at that particular price point. But still, we're looking at getting class 2B medical device certification, which will allow us to sell through insurance. And once we can prove, especially for people who've recently lost their sight, and then that can be used as a tool for therapy, getting used with the new way of life, then I will definitely be able to sell through insurance. And then I think that will make us grow very, very quickly.
Right. Okay. Fantastic. That's really interesting. Again, insurance raises its head. Something for us to look at in the future, perhaps. All right. Thanks so much for that, Brian. Right. I'm going to open up a couple of questions to the panel. If you want to answer it, jump straight in. If no one answers it, I'll pick on someone. So it's up to you guys. But first things first, I just wanted to talk very briefly about policy. Now we're always, well, I am anyway, quick to blame policymakers and government. It's particularly easy to do that in terms of the UK government at the minute. But to what extent are we in a kind of a chicken and an egg scenario whereby we need data provided by companies like some of yours to help inform policy, but we also need a policy to help create the environment that makes it easier for companies like yours to collect the data. So I'm just curious to know whether or not COVID has changed that dynamic with policymakers, or whether or not, you know, you're still coming to loggerheads with people who are regulating the markets you work in. Yeah, so if anyone has something interesting to say on the policy side of things, please feel free. But if not, oh, hi.
Thanks, Nick, for that. I think EMSCAN, we've had interactions with ministry, but on the basis that we had already done some pilots and had some data. I'm not so sure about companies that are just emerging because of COVID-19, because there's now a lot of issues around credibility, if these are actually using COVID-19 as an opportunity or as a basis to, you know, thrive and get funding. So I believe it might be a little bit tricky for companies that are just starting right now. But those that have data, that have the impact, that have already proven that, you know, their solutions work and, you know, they can prove the impact, I think it's high time, if not too late, to already start these discussions with the different governments. For us, with the Ministry of Health Uganda, we've had only positive discussions with them, and we've presented to them results of pilots. So I believe it would also be prudent for startups that deal with a lot of data to publish this data in journals. If this is accepted, then it gives basis for validation from the ministries.
Okay.
But also to add, you know, it's key to also note that still there is gap and there is room for improvement from ministries, because COVID found us not ready for, you know, adjusting to telehealth. So governments didn't have, like in Uganda, they didn't have a proper framework through which telemedicine companies operate. And they've already started working around this with one of the renowned telemedicine company in Uganda called Rocket Health. They've leveraged around the frameworks already built by Rocket Health Uganda to come up with proper frameworks in which they can now regulate other health tech startups that are coming up. But I would say, I mean, it's innovation in, like Jean was saying, it's a Trojan horse over which the legal space, follows. So we shall get there, I guess.
Yeah. Okay. So a war of attrition, maybe, but we'll get there in the end. Thank you very much, Innocent. Yeah, Shayan, hi.
Okay. Hi, Nick. Yeah. So for Nigeria here, we actually have something similar to what Mr. Menyo just mentioned. So we have our data protection organizations here, which are very specific on how secure data is. So before you even decide to accumulate data or get big data, you need to get approval from basically the government bodies. So the rule here is that all data belongs to government, all data should be shared with the government. And basically, their major issues are basically on security, where your data is hosted. Do you have approved? Do you have the license certifications, hyper certifications, HR certifications, basically all that. Once you go through those stages, then you can then decide to accumulate data. The other thing which the government did, or which COVID-19 actually helped us with, is actually creating a stakeholders forum. So the government decided to invite Thalamus. Basically, we have a private group where we call ourselves the digital health entrepreneurs. So we all came together, were invited by the government to basically interact, discuss, and see how we can improve on data policies, IT policies, telemedicine, because we realized that, yes, there are existing laws on medical practices, legal issues, but for telemedicine, it's kind of basically new here. So the issues have not really been addressed, basically, but we're currently working on that. Thank you, Nick.
Got you. Okay, right. So again, actually slightly more positive, I guess, reputation for governments there than I was expecting. Maybe it's just me who's not crazy about the government in the UK at the minute. Anyway, okay, that's really interesting. Thank you, guys.
Can I just jump in there with the Kenyan perspective as well, just to echo what Dr. Sean has said, that indeed there's a very collaborative approach here as well. We've had, the COVID-19 task force, and again, all sectors coming together, the Ministry of Health, the Ministry of ICT, so that it's not just one sector pushing it through. Here we have the Kenya Healthcare Federation, who represent the healthcare sector in the private sector alliance, and they've been really pushing through for telemedicine and digital health and trying to push these bills through parliament to get them accelerated. So again, it's not for one person to do this, not for one innovation to do this, but again, as I mentioned on the collaboration front, it's for everyone coming together, going to government, and they've been very accommodating, having meetings, pushing the agenda forward to the Attorney General's office as well. So indeed, here in Kenya, we're also seeing the same thing as in Nigeria.
That's interesting. Okay, thanks very much for that, Jean. Okay, there seems to be a pattern emerging then that, COVID's acted as a bit of a catalyst to perhaps speed up the application, whether it's creation of focus groups or speeding through regulation. So that's really interesting. Thank you. Okay, great. Final question, I think, and it's kind of a key one in lots of ways. I'd like to talk about money very briefly. Of course, we know it makes the world go round, but for those of you who this is relevant for, perhaps those of you who are seeking investment to grow either through equity or debt, has the pandemic acted as an opportunity to focus the minds of investors to get behind Africa-based medtech businesses like yours, or have you found that investors or venture capitalists that you might be speaking with, that they're sitting on their capital and waiting for all this to blow over? Have you got any sense of optimism about the future of investment in this space in Africa? Again, that's open to anyone who fancies having a crack. Shayan, yeah, go for it.
Okay. So in terms of investment, I would say, so even some of the investors are having a hard time when it comes to investing everybody had a big hits during that period. So basically, I think it's kind of a balance. So you have where investors want to invest, but basically what they usually look out for are the numbers. So which was basically an advantage to us. We had a lot of traction from Asian investors. So a tip for the other people in this session, basically, Asia is really interested in Africa. We have a lot of people that are trying to look into basically technological advancements. You'll be surprised that most of the healthcare processes in even Japan are not actually digitized. They're still on paper because they have basically paper is still going to be your biggest challenge in terms of electronic health records and all that. But the best thing is, if for investors, I think, yes, there's actually a better traction since after basically last maybe 3-4 months of the pandemic. That was when things were getting a bit stable, especially here in Nigeria. We eased on the lockdown, and we had investors basically trying to see how they can improve on or basically invest in healthcare solutions here, not just particular to Talamas, but to other businesses too. But I think it's a good thing. I think COVID has created new opportunities for small businesses.
Okay, all right, really interesting. I guess that's true of any business seeking investment, isn't it? It's important to be able to show traction and show an investor a potential opportunity. Okay, was there anyone else who wanted to contribute to that question?
Yes, Nick. Regarding investment, in particular in Uganda, what I've seen, and of course, conversations that keep growing up is there's reduction in foreign investment, foreign direct investment, and what now we are seeing is how can startups maximize the available local investors, that have already set foot in the different countries where they operate. And we've seen this firsthand because before COVID, we were finding challenges to collaborate with some local investors like JICA, the Japanese International Cooperation Agency. But with COVID, they've come on board and we are now working with them. So I think there is now a lot of potential to tap into local investors versus, looking out for foreign investors. Well, they could be there, but they're quite uncertain at times, and investors to, risk the money into markets that they're not sure on how the guidelines are being implemented and how, the shape, is going to be in the face of COVID-19.
Yeah. Okay. So yeah, uncertainty, creates a challenging market, doesn't it? Okay. All right. Well, unless we have anyone else would like to make a final comment on money, I think since we've ran over slightly, sorry about that, everyone, we will wrap up for today. I'd just like to take a second to thank our speakers, Innocent, Shen, Jean, Brian, and Shafiq. Thank you so much for joining us. It's been a real pleasure hearing from you about your thoughts, your businesses, and your thoughts on the industry going forward. Thanks, of course, to our participants and attendees. Great to have you with us. This is the last event of the year for BOBAB, but we will be back with a very busy 2021. So look out for upcoming events, and look forward to catching up with you all then. Thank you very much, everyone. Goodbye.
Bye. Thank you.
All right, thanks.